Hi, this is Dr. Charles Kuntz, and I'm one of the surgeons at Southpaws. Today I'm going to talk to you about the removal of an eyelid mass in a cat with reconstruction using a lip-to-lid transfer. If you have any questions or comments, please feel free to post them. The margins around the eyelid tumor are identified. Because this is a feline mast cell tumor, the margins don't have to be as aggressive as with a canine mast cell tumor. Excision is performed as a combination of electrodissection and blunt dissection.
Thank you. You know the plan for the
Going home. Are they here? The majority of the conjunctiva is preserved, making sure to remove any conjunctiva that might be infiltrated with tumor.
So you normally reconstruct that conjunctiva onto the mucosa lip?
The medial canthus is reconstructed using interrupted sutures.
Did you ever, appears to be, in terms of how well that's resolved with surgery?
Yeah.
Well, generally not, or?
Generally they are, although about 25% relapse.
Yeah. What percentage of them don't have endocrine?
I don't know. I don't know how they would find, yeah. I guess unless they present mistakes in ICU. Yeah. Students administering, one student administered potassium chloride IV instead of putting in fluids.
We're not putting food into this cat.
That wasn't my intent, but
So ideally, you should have to remove the eye.
yeah. I mean, we'll see. I'll tell you in a week.
The borders of the flap intended for transfer to the upper eyelid is identified using electrocautery. The lip margin is going to be transferred to the dorsal palpebral region in order to reconstruct a mucocutaneous junction.
Suture that mucosa to the conjunctiva.
Yeah, that's what we're doing. Fire, Allison.
A large proportion of the intraoral mucosa is preserved with the flap in order to allow reconstruction of the conjunctiva.
Something.
The cornea is continually lubricated using buffered saline solution.
I got a 5-0 Vical or a 8-0 Polysol.
I'll take some 5-0 PDS.
Good elephant. What medication should we use in this cat's eye? After surgery.
I don't know, not much.
E. coli, I think, would be
When
a
you're
good
saying
idea.
to do a tarsorrhaphy, do you mean to close both of those up?
Is that all?
Yeah.
Is that all?
6 times 5, 3.
The intraoral mucosa from the lip flap is sutured to the conjunctiva to reconstruct the mucous membrane.
How we cope with that need. Allison?
The cranial border of the lip flap is sutured to the medial canthus of the eye.
It doesn't, yeah, no, typically not.
The skin is closed using a meticulous intradermal suture pattern.
That even along the pigmentary.
Yeah, I did wonder whether that was
Intentional? Absolutely.
We just have a monologue.
Next, I'm going to look down on your hands and knees.
Is that
I am a bit.
mixed feelings?
Yeah. Yes, but they can't have one because it's only Mike at the moment.
Yep.
So she goes back up there and she continues to work with Mike, then they'll need a second nurse, but that's not going to be for ages.
Is she?
Karen's coming to Brisbane as well.
Is she?
Uh-huh.
For real?
Uh-huh.
She likes that tucking in.
Yeah.
Closer than I wanted.
Yeah, well, she can get over to Vanuatu for like $200.
Yeah.
She moving in with you and Eddie?
No.
It's like
It isn't
full
too-
circle.
Yeah, yeah, I know. Yeah, he said he used to live there and then, well, Chantal and Barry are back onto what we can do or, yeah. No, she doesn't. I think that's something that to make it better.
Have you heard from Mel?
No, I sent her a text this morning and I just sent her an email. I haven't checked my email since I sent it. Yeah, I don't know what we can do. I think she's got all this really great.
The defect in the oral mucosa is reconstructed using a simple continuous suture pattern.
Yeah.
Yep.
is there any,
Well, alright, thanks, Jen. We'll see you Thursday. Okay, bye.
I'll ask. Allison, can you get Allison in here?
Just go to ask her if she wants to do the test.
I'm happy for